Thank you all, and thanks for joining today. I'm Crystal Tyler Mackey in Virginia Cooperative Extension, serving as a specialist in community viability as well as an adjunct faculty member in the Department of Human Development and Family Sciences. My teammates will introduce themselves when we get to their portions of the presentation. We also ask someone from the University of Kentucky, Alex Ellswick, to join us today and share a little bit about the things that are happening in Kentucky. Once we learned about that, we thought it would be great for you all to be able to hear what's happening there as well. The first thing we'd like to do is find out why you're here and what you'd like to get out of this presentation. So what are the things that bring you here? And Catherine is going to put up a poll so that we can participate in the poll.
Yes, so if you'll go ahead and answer, the poll should be live. We'll give everyone a few minutes. And we've got almost everyone responding. So far, our top response is looking for resources, followed very closely by concerned about your community.
Great, thank you. Well, we hope to start talking about some of those resources, and that we'll also be able to, as we get to the end, start to learn more about the things that are happening in your state and what some of the resources are that we might be able to tap into. So we'll start with a little bit of information, and my colleague Debbie Jones will share some things with you.
Good morning. My name is Debbie Jones, and I am health specialist with Virginia Cooperative Extension at Virginia State University. And first, as you look at the slide itself, I'd like to tell you a little bit about what opiates are. And they are referred to as a class of prescription painkillers, and along with the illegal street drug, heroin. There are, these are most common brands of generic names, as you see listed above, and they each have different street names as well. Research has shown that many people don't really know the full risk of these drugs, and they may give some of their prescription pills to relatives and friends. Carfentanil is the newest and the one that elephant tranquilizer. Many of these are available on the black market now. So these are some of the names, and you can see that carfentanil is about 100 times stronger than most of the others. Next slide. Okay. How are they misused? Over at www.virginiaware.org, you can look and see. Some of these drugs are over two-thirds of young people that are age 13 and above use prescription medication that they've gotten from their family or member or friend, family member or friend for free. They don't even have to pay for them. So the Virginia Department of Health borrowing or sharing prescription medicine is a huge problem. Prescription heroin connection. We can see that some wonder why heroin and prescription medications are talked about so much, and here's why. Approximately 3 out of 4 new heroin users report having abused painkillers before they've begun using the heroin. So this is one of the reasons why we're seeing that there's an increase. Deaths have tripled, and they're freely available. So those are some of the reasons why in the last 5 years, deaths from heroin have tripled in the last 5 years. It's become our problem. The opiate epidemic in 2016, we can see 116 people die every day from opiate-related drug overdoses, and about 11.5 million people misuse of prescription opiates on a day in 2016. And you can look at the numbers and see how much it's what is causing and the types of uses that we're seeing. all opiates death in Virginia has become a real problem from 2007 up until 2016. It's more than double the amount of uses in prescription drugs and illicit opiate drug use. 2007 from 515 to well over 1,000 in 2016. And this is just a number from 2016. So we can see how it's increased over the years. And now Tanya will begin to tell you a little bit about what we're seeing in newborn babies and how it's causing, what the effects it's causing for our young families.
Thank you, Debbie. Good morning, everyone. Hopefully you can hear me okay. My name is Tanya Price, and I'm an associate professor and 4-H extension specialist with Virginia Cooperative Extension, and it's a real pleasure to be here with you all this morning. Given my role with 4-H, I would like to share with you some statistics of how the opioid epidemic is affecting our youth. Every 25 minutes, a baby is born suffering from neonatal abstinence syndrome, and this is due to their mothers using opioids during pregnancy, which results in an average 17-day hospital stay and costs the family $66,700. Children are affected greatly by this epidemic and are increasingly being left without parents, as nearly 1/3 of our children entering foster care do so in part because of parental drug abuse. And these numbers don't even include the children being taken in or cared for by relatives. In regards to teenagers, 62% have abused opioid pain medications or know someone who has, and they believe that better education could have changed their behavior. Now, as disturbing as these statistics are, we do have a 4-H program that can help provide education to young people and turn these numbers around in a more positive direction. And that program is our Health Rocks program. And Health Rocks is a 2-part evidence-based preventative education program that focuses on helping middle school age youth make positive choices and avoid risky behaviors, such as drug, alcohol, and tobacco use. And through implementation of this program, and we've received grant funding to implement this here in Virginia, we have seen positive results in youth disapproving of engaging in risky behaviors related to substance abuse. So now that you know at least one of the programs that we are doing that's youth related, we would like to hear from you all. We have a poll that's up on the screen. So are there efforts being implemented or planned in your state to address this epidemic, either with youth, adults, or both? So if you could just take a minute to answer the poll. I'm not able to see the results, but if someone could share that with us.
Yes, so we're giving everyone a couple more minutes. We still got about 20 people left to respond, but
Okay.
so far it's a pretty close tie between both and unsure.
Okay.
Very little for no efforts, and then a small amount for youth and adults.
Perfect. Well, that's great to hear that there are things that are going on across the nation. Thank you all so much for participating in that. At this time, I'm going to turn it over to Dr. Vons, who is going to be sharing more with you about what we're doing here in Virginia.
Thank you, and I'm Karen Vines, and I'm an assistant professor and continuing professional education specialist in Virginia Cooperative Extension here at Virginia Tech. And my involvement with this is serving as a PI for rural Virginia, or a grant that we've developed, Preventing Opioid Abuse in Rural Virginia, that was funded through the Rural Health and Safety Education program of AFRI. And you all said you're using both. Well, this approach is actually targeting both as well. We're with youth and also targeting some adults as well. Could we get the next slide? As you can see, we have a large team working on this project, and this is really a great opportunity for us to come to bring a lot of different sources of expertise together to try to solve what is an extremely complex issue that really none of us can solve on our own. And so within our program, of course, you've heard from us in Cooperative Extension, but we also have people from some of our campus centers that are the Virginia Tech Institute for Policy and Governance. We have our Virginia Rural Health Association represented, as well as our Public Health Research and Action Center also included. So, you know, and this is just the state management team. We also have community teams that are involved as well. Next slide, please. So what we're doing, part of the project is a high-risk patient education program. And this actually provides training for patients that are identified as being high risk as they are leaving the hospital setting and or visiting a doctor. And to determine high risk is actually anyone who's being prescribed an opioid for use going home. So the hospital staff are trained and they hold the conversations with the patients and their family. And then we will send them with resources that they can use once they return home. I believe I need the next slide, please. Yes, so that was the adult piece, although it could also encompass youth as well, but it's more targeted to adult audience. This, the Prosper program, many of you are probably familiar with, was a program that is actually targeting youth in middle school settings, 6th and 7th graders. And this is the program that was developed through work of Iowa State and Penn State University. And it is an evidence-based system, and it's been shown to reduce risky youth behaviors over a long period of time following the intervention. We use both family-based and community-based or school-based interventions, with the school-based interventions taking place in 7th grade following the Strengthening Families 10 to 14, which will be our family-based intervention in 6th grade. So we're really excited to see how this model fits in Southwest Virginia in 2 of our sites, and are hoping to move forward then in other areas later. Prosper was actually developed to work with alcohol and drug addiction, not necessarily with the opioids. However, we are transitioning it to the opioid. So in addition to looking at our local context, we'll also be looking at how Prosper works with the opioid crisis. And so there have been materials that have been added that are specifically intended for the opioid issue itself. So stay tuned. We look forward to talking to you about our results in the future. I'll turn this over now. I believe, Crystal, are you going to take it from here? Oh, and I guess I'm sorry, I forgot I have one more slide. One of the things that has been really great is the opportunity to work with this large team that I mentioned earlier. It's been a real learning community as we've come together, and we've all contributed our areas of expertise. And so one of the things that evolved, we were given funds from our provost to host a conversation related to opioid abuse. And so we talked about how to approach this, and what we've decided, we are inviting 2 individuals from each of our Virginia institutions of higher education to participate on May 1st in a conversation on opioid abuse and addiction, so that we can kind of think about what it is that we have to offer as a group of institutions, and can kind of develop a unified research approach. We felt like communities they're having listening sessions, they are very aware of the problem, but they're really looking for answers. So this is our opportunity to come together and see how we can help them to solve some of the problems they're dealing with. And now, thank you. I'll turn this over to Dr. Tyler Mackey.
Thank you. So just what you said, a number of you said in the poll, looking for resources, curious and looking for resources. That's the impetus for hosting this conversation. I know that in Virginia and maybe in other states, there are groups holding community level conversations, and that is the key question that's coming out of those conversations is where are the resources, what are the resources, how do we access them, and how do we get them? And so hosting this higher education conversation, the intent behind that is to look at where those needs are, where there are current resources, and where there might be opportunity to link together, to learn from each other, to do some joint projects and joint efforts so that we can all work together and bring what we can bring to the table to address this large, complex issue. In Virginia, one of the things that has been put together to address the issue is, and this is from the state, not from Extension, but from our state stakeholders, is a website called VAaware.com, and they've now relabeled it and marketed it Curb the Crisis. So I just put that up there because sometimes as we're looking for resources and information, websites may have some things, and this is something that is continually updated by a number of our state agencies. It includes some other information outside of just Virginia, but I wanted to put it up there and also frame some of the conversation around the different places, I guess, where we might be offering programming, or where others may be looking for resources and support. So certainly on the prevention side, and for this VA Aware site, each of these are links that you can click on and find access to more resources. So on the prevention side, and what you heard us talking about, our approach, the three pieces that we're doing are all pretty heavily on focused on the prevention side, whether it's a longer term prevention strategy among youth, whether it's a prevention strategy among those patients who are leaving a hospital or a medical setting with a prescription. It's still on the prevention side of things. And there's work to be done there. There's some on the rescue side. One of the pieces of information that happens in those one-on-one conversations through the high-risk patient education program, first of all, those conversations are very I'll say simple language. It's intended to be a conversation, not the healthcare provider talking at, but actually a sit-down, one-on-one conversation. Oftentimes when someone's in the hospital, their loved ones are nearby, they're around, so they get to hear it too. They hear the risk associated with taking a prescription opioid, but they also get information on how they can access Narcan or the recovery medication if needed. Some earlier pilot studies showed that even if people were aware of it, they felt like it was inaccessible to them due to the cost or expense. So a part of that conversation is also helping them find out how they could access it. So that's on the rescue side. And in Virginia, and probably in some of your states, there's a standing order where pharmacists can immediately, prescribe this and give this to someone. They don't have to go to a doctor first to get a written prescription for that. There's treatment information on the treatment side, which for many of us, in Extension, that may be our partners, one of our partners' mission. But certainly people are looking for treatment resources. And then on the recovery side, what are the resources and the things that are available on the recovery side, and how do we support that? And I'm going to go to one more slide just so you have it for resource. And then I'm going to ask Alex to share what is happening in University of Kentucky Extension, what they're doing. And I'm particularly excited about some of the work that they are doing on the recovery side. Before I get to Alex, I just want you to see that this website was recently launched from USDA, and it's all about the opioid-related issue at USDA.gov. You can find it by going there and clicking on topics. And this information is also continually updated, so you can find legislation, you can find statistics, data, grant funding opportunities, all kinds of information around the opioid-related issues. So I'm happy, before I do that, I'm happy to turn this over to Alex and ask Alex to share some of what's happening in Kentucky, and then we'll come back and ask you to put in the chat box what you have going on in your state. So, Alex.
Thank you, Dr. Tyler Mackey. Can you all hear me okay? Yep. So my name is Alex Elswick. I'm a PhD student at UK, and I work here in Extension. And my research focuses on long-term recovery from substance use disorders. I'm going to share my screen here, if I can do that. There we go. And my research focuses on long-term recovery from substance use disorders. I co-founded a nonprofit organization called Voices of Hope. We also focus on long-term recovery. And so to give you some context for some of the work that we're doing at UK, I wanted to kind of give a little bit of the theoretical foundation that we're working with. So we know that substance use disorders are chronic conditions. So like asthma or diabetes, they have to be treated on an ongoing basis. But unfortunately, our existing paradigm for treating addiction has been to use an acute care model, which is to suggest, yeah.
Alex, I'm sorry. Could you do your end presenter view, the three dots down under your screen right there, and click hide presenter view? Then we can see your whole slide. Perfect.
There you go. Have you got it?
Yes.
Good. Thank you. So sort of the existing paradigm right now for treating substance use disorders is an acute care model. And if you think about it, you know what I'm talking about. We send somebody to inpatient treatment for, let's say, 30 days, which is great because on day 31, they're 30 days sober, but they walk out of treatment ill-equipped to maintain their recovery. They have a chronic condition and it's been mismatched with an acute treatment. We call that treatment intensivity. And what we're calling for is more treatment extensivity. So sort of treatment and resources that match the chronic nature of addiction. And so some of the ways that we're accomplishing that, it's through a concept called recovery capital. But basically it's saying, here are all the things that a person needs with respect to holistic health and wellness to maintain their recovery. And we have divided into personal and social and collective recovery capital. And the reason that I think this should be the emphasis for Extension, and it is at the University of Kentucky, is because Extension is uniquely positioned to do all these things already. Certainly we can do some of the prevention programming. Certainly we can assist with like things like naloxone trainings and things of that nature. But it just so happens that recovery support are the things that Extension already does so well. So things like we know that financial stress is a significant psychosocial stressor that can lead to relapse. Well, we have family resource management associates who can help people address those issues. We know that parenting stress is a psychosocial stressor that contributes to relapse. Well, it just so happens we have a parenting specialist, right? So what we're doing at the University of Kentucky is leveraging our existing Extension programming and taking it to treatment centers and to halfway houses and sober living across the community to try to help people maintain their long-term recovery. We're also working on a pilot partnership, Dr. Hunter and I are at UK, with our Polk Dalton Clinic, which you referred to neonatal abstinence syndrome. And so the Polk Dalton Clinic in Lexington is sort of on the frontier of perinatal and postpartum support services for women who are addicted to opioids and on medication-assisted treatments. And the problem is that most of the women who are patients at the Polk Dalton Clinic have to drive from far eastern Kentucky into Lexington on a weekly basis, which creates a lot of stress in their lives. And so we're going to take some of that programming out into the Extension offices in partnership with UK Healthcare. We're also exploring some of the Prosper programming. We're really interested in some evidence-based prevention programming. And finally, just recently, I did a couple of in-service trainings to kind of an Addiction 101 crash course on addiction for our Extension agents because I'm a firm believer in the need to reduce stigma. I guess I could mention my interest in substance use disorders comes from the fact that I'm a person in long-term recovery from a substance use disorder, that critical pathway we talked about from pain medication to heroin. And so I'm uniquely familiar with the horror that comes with addiction, and it's so personal to me. And so I believe in the need to reduce stigma and to kind of get people behind the recovery movement. And so I'll just say this and I'll shut up. I firmly believe in the need for prevention, but I think it's easy emotionally for all of us to get behind keeping 6-year-old Sally off of drugs, because she's yet to make any decisions that disappoint us. I think it's a lot harder emotionally for us to get behind supporting maybe 23-year-old Alex Ellswick, who's addicted to heroin and homeless in Dayton, Ohio, and has made a number of decisions that disappoint us. But it's critical that we maximize the return on investment that we create when we send somebody to treatment by helping them maintain their long-term recovery. And so that's some of the work that we're doing at UK. I'm happy to answer if you have any questions afterwards, but I don't want to take up too much time, so I'll pass it back off here.
Thank you, Alex. And so there may be other things that are happening in your state. We know that there's some discussion and some need around supporting sometimes families, oftentimes grandparents or other relatives that begin to take children in and raise them because the parent or parents are unavailable for whatever reason due to the opioid epidemic. And so those individuals are needing some support as well. So that's another place where people may be intervening and looking for or providing resources. So would like to get back to you and find out what is happening in your state. So if you would open up your chat box and type in some things that are happening in your individual states. Okay.
Crystal, we had someone
Yes.
ask, will the slides be available after the webinar? I will gladly share this PowerPoint with everyone if you'd allow me to do that.
Great. Absolutely. That would be great. And I see some other things coming in through the chat. So,
Okay.
Alex, there's some thank yous to you in there.
Mm-hmm.
Thank you to Alex for your transparency and the challenge to be mindful of stigmas. Absolutely. Alex, there's some requests for training. I think you might be pretty busy. Alex, very compelling. Thanks, Alex. Would you be willing to share your training with the county agents from Julie? Julie, I asked the same thing before they ever did it, and I caught them a little too close to it happening for them to be able to actually record it and have it available because I wanted the same thing. So, Alex, I think you and Dr. Jennifer Hunter are going to work on something for us maybe. Some others are doing, Joanne Leatherman is doing Health Rocks programming, but they don't have the grant funding. So, Dr. Price, is there an opportunity, Dr. Tanya Price, is there an opportunity for people to access some grant funding that you are aware of?
I'm sorry, I was trying to unmute myself. We are very fortunate that we have received grant funding from National 4-H Council because Altria is headquartered in our state, and I know they're headquartered in some other states as well. I'm not sure about grant funding, but what I will say, or additional grant funding, but what I will say is the curriculum is available on Shop 4-H, and a lot of the supplies that we use to implement the activities that are within the curriculum, you can purchase from a low-cost store like the dollar store. So it doesn't cost a whole lot of money to actually do the activities, but we're able to get some more of the advanced, like the drunk goggles and all of that through the grant funding. But I think you could still implement the program on limited funds.
Thank you. We have Arkansas. I know Dr. Lisa Washburn is implementing the chronic pain self-management program in rural areas. I think that's one of the other rural health and safety education grants. So looking for alternative ways to address pain in rural communities, partnering with healthcare providers. Joanne Leatherman, what state are you in? Could you type in the chat what state you're in? Convening a special task force. Virginia convened a special task force, and one of the outcomes of that task force is the website that I showed you, the VAaware.com, which is now being branded as Curb the Crisis.
It looks like Joanna's from Maryland.
Thank you.
Maryland.
All right. So Maryland is starting their task force. In New York, assessing the role of extension, where a lot's going on, and we have unique county level set up with 54 county associations. I think a number of us are still figuring out where extension can plug in. Clemson, partnering with the medical university to put health extension agents in high-risk counties. Oh, I might need to follow up with you, Julie, and find out more about that. So trying to identify the problem and develop a program to address the problem. Yeah, I think we all are looking. There's so many different places and ways and opportunities to contribute, but it's a big issue. Looking at ways to support communities and families and leverage current extension programming, and partnering with other health professionals and researching the impact on businesses in the ag industry. There's a good amount of discussion happening with that around the opioid epidemic and that impact on growers and farmers. All right, so Alex, there's you recording your the training that you did for future impacts. Right. Legal policies regarding how much painkiller patients can get within a month. Certainly a lot of the states are looking at policies and legislation around that. I know the USDA website that I showed you, as well as the one in Virginia, is showing legislation around that. Okay. Tennessee is doing some low-level 4-H youth programming in schools. And this is from Charles Malone, a national 4-H mapping group called GIS GPS Leadership Team, looking into using data on various health aspects in order to help communities become more informed on health issues. Interesting. Robert Wood Johnson is partnering.
Yes.
Yeah, so county health rankings, all of our health people on the line are probably very familiar with the county health rankings data, but it's a great resource. University of New Hampshire created a behavioral health initiative to improve and expand efforts to address substance misuse and mental health efforts. Extension efforts focused on mental health and social, emotional, and mindful learning. It's a great link. Catherine, are we able to access the things that are in the chat box?
You mean, are you able to click on the links?
Yeah, afterwards.
You should be able to.
Okay.
I would say go ahead and open up any of the links and just save the tab.
Okay.
But when I send out this PowerPoint, I can include all of these links as well.
That would be great if you could do that, because I think there's some great information and resources in these links that we'd all like to have.
Sure, we can definitely do that.
Great, thank you. FCS in Palm Beach County. Not aware of any programs in Florida yet, but the epidemic is having a significant impact. All right, continuing to have the conversation. I think we all are, and I think we'll have to continue to talk and learn from each other. Oh, Dr. Alicia Shipley. Thank you for joining Dr. Shipley from USDA NIPA. This work is being done to address opioid epidemic through our rural health and safety education. That's what we're doing, so we're one of those grantees. Thank you. And Arkansas is on the line, so thank you for that.
Oh, sure.
Yes. And Mark Skidmore, one of our other Regional Rural Development Center, creating an inventory of extension activities targeted at addressing the opioid epidemic. Would it be possible to get feedback on chat to add to the inventory? That's what we want. That's the same thing, question I just asked as well. That would be great. Mark Skidmore, do you know when that will go live, when the inventory will go live? what will be really neat about this inventory of extension activities is that while we have the USDA site, we have the Virginia site, or possibly your own state's site, and others, this is very specific and targeted to what we are able to bring to the table from an extension perspective. Anyone see that? Okay. Right. There's some great information in the chat box, some other links, so we'll absolutely want to gather all these tools and resources. I haven't seen it come up yet. Have you all? When the inventory for extension will go live?
Mark said within the next few months.
Within the next few months. Okay, great. So I would imagine that all of the regional rural development centers, as well as NIFA, would send out that link when it does go live, the link to the inventory for what extension is doing. And I would think there's an opportunity for us to chime in and add as new things are happening in our state, or if we haven't contributed anything to that inventory, to be able to do that. So maybe when we send out the link for this, Mark Skidmore, or whatever the link is for adding anything to the inventory, if there's something that isn't there, we may want to include how we get that information to ensure that it's listed.
Dr. Tyler Mackey, I did see a question in the chat box about where you can get the Health Rocks resources.
Great.
And if you go to shop4-h.org, and you can just type in their search bar Health Rocks, and you'll see where you can purchase that curriculum.
Great. Thank you. Thank you for helping me not miss any other questions. I do see a question that says, do you have brochures for adults and children that can be retrieved from a website that can be downloaded? And that says to all panelists. Prosper, the program that we are using for the middle school students and their families, that there's a website. It's helpingkidsprosper.org. And there is a great deal of information there that can be downloaded. We don't have a Virginia specific one. The high-risk patient education program that we are implementing through the Virginia, in partnership with the Virginia Rural Health Association, those materials are not developed at this point. There is some information that can be found there by going to the Virginia Rural Health Association website. And Alex, I don't know if you have some materials developed. Alex is on mute. We can't hear you, Alex.
I'm sorry, will you ask that again?
Do you have brochures or materials available via a website at this point that can be downloaded?
Not yet. We're getting close. We're working on it.
Okay. Okay. Great. Thank you. Anyone else on the panel, or Catherine, am I missing some other questions that we need to address?
I don't see anything, but
Great.
Yeah, we had a couple more links, and again, I'll make sure to email those out with the PowerPoint.
That would be great. I want to not take up too much time. I do want to show you something. I hope Alex is okay with me showing this. I'm going to go off of this page. I can get off of this one. Alex has, if I can't get it to come up, Alex has a wonderful sharing of his story that's listed on the UK site, and it's here. Let's see, resume sharing. So UK highlighted Alex and shared his story and where he is on his journey. And so I'm hoping this isn't embarrassing you too much, Alex, but in appreciation for your transparency and for the contribution that you're able to uniquely make. We thank you for that. And if you want to see more, I just wanted to make sure you all had a chance to see that this is also available. So.
No, I appreciate that. If you Google my name, it's forever tethered to the words heroin addiction. So it's very public. No shame in that for me.
And so again, our intention of coming together today was to share a little bit about what we're doing in Virginia. We're grateful for Alex being able to join us and share what's happening in Kentucky, and just to provide an opportunity for us to talk and learn from one another, because it is, we're talking about it, we're knowing that there are more issues. The issue is rampant, but there are also opportunities where we can plug in. And so learning from each other and figuring out the different ways and strategies that we do that with our partners is the intent of this session. So we thank you all for joining. We hope you found it useful. We certainly have some more resources and opportunities that we can pursue as well. So at this point, I want to say thank you, and thank you to Catherine for being such a great host for us.
Yes, thank you all for doing this great presentation, and thank you all for listening. Like I said, I will be emailing everyone with these slides as well as all the links that we talked about. You can also go back and view this recording from the beginning, and that will be posted on the SRDC website as well. And I guess we'll go ahead and sign off. Thank you everyone for joining us.
Thank you.
Thank you.
Thank you.